Hi, hi viewers, welcome to MouShauk. So today we'll be starting our new chapter according to ICSE syllabus class 9. This is diseases, cause and control. So before I start, I will request you to please do subscribe my channel if you have not subscribed yet or if you are a new viewer to my channel. And if you're liking the videos, press the like button, share with your friends so that they can also be benefited from these videos. And while starting, please to meditate. Okay. So before you start, do meditate for just 1 minute and then start. Okay. Whatever you are doing, please to meditate for 1 minute at the beginning and then start your job. Whatever you are doing, either studying or doing any other work. Okay. So let us also meditate for 1 minute at least. For that, please concentrate on the point of light. That light is pouring into your whole body is become full of light and you're feeling and your body full of energy. You're feeling relaxed without any tension in the body and feeling that you can do the best for the day. You're working hard for doing so. And at the end of the day, you're giving the feeling of the body, for doing the day, and prepared that everything. Let's start with the discussion. So, disease, cause, and control. Okay. So, what is disease? It is a condition in which the normal function of the body is disturbed. How it is disturbed? Through structural and functional disorder of the body. There is some disorder inside our body. It may be structural or functional, which will hamper the normal functioning of the body. That is the disease. That condition is disease. Okay? Now, we categorize disease in four ways. Okay, that is, first is extent of occurrence. Okay, second is communicability, kinds of pathogen, and kinds of transmitting agents. So, extent of occurrence means how much it is spreading, how much how much area it is covering, that is, okay, that disease. So that is extent of occurrence. Like endemic, it is, there are four types: endemic, epidemic, pandemic, and sporadic. Communicability, that is, whether it is infectious or not. Kinds of pathogen by which germs the diseases are caused. Okay. Maybe bacterial, maybe viral, maybe protozoan, or it may be caused by helminths or worms, you can say. Then kinds of transmitting agents, how they are transmitted, how they are spread. According to that, the diseases are being categorized also. Like it may be airborne, waterborne, foodborne, or insectborne. Okay. Now, categories of the diseases which are based on extent of the occurrence. I told you endemic, epidemic, pandemic, and sporadic. Now, communicability, it is non-communicable or communicable. Okay? So, non-communicable is also known as non-infectious, or communicable is also known as infectious also. Non-communicable diseases are like nutritional deficiency diseases, metabolic diseases, genetic disorders, allergies, degenerative diseases, mental illnesses, cancer. Okay, these diseases are those which are not transmitted by any germs. Okay? They are not transmitted by any pathogens. And communicable diseases are those which are caused by pathogens like bacteria, virus, protozoan, or helminths. Okay? Now, diseases that are caused by bacteria, okay, tuberculosis, typhoid, cholera, tetanus, syphilis, diphtheria, whooping cough, pneumonia, leprosy, gonorrhea, these all diseases are caused by bacteria. Protozoan diseases are malaria, amoebic dysentery, sleeping sickness. Okay. Then the diseases that are caused by worms are ascariasis, caused by ascaris, teniasis, that is tinea, and filariasis, also a disease. Okay. Now, diseases that is caused by virus, HIV or AIDS, chickenpox, hepatitis. Okay. Now, we come to the description of the diseases. Okay. The first is endemic disease. Endemic disease is a disease that is found in certain area that attacking only a fewer number of people. Okay. Endemic is a disease. It is the disease that is categorized under the extent of occurrence. So here, number of people, those who are affected, they are in fewer number. Okay, like yellow fever in certain African countries. Okay, then goiter in sub-Himalayan regions. Then we come to epidemic diseases. Now, these diseases that break out and spread from place to place, larger number of people at the same time, involving larger number of people at the same time. So here, epidemic means there's the breakout of the disease and spreading it and affecting larger number of people. Okay? Like plague in India in 1994, where it is spread from Surat and many other places. Okay, it spread widely from Surat to many other. Next, we come to pandemic diseases. Diseases that are widely distributed worldwide. Pandemic diseases is worldwide spreading diseases, okay? Like AIDS. Then sporadic diseases that are scattered individually. Example, malaria and cholera. Okay? The sporadic diseases are the diseases which are scattered individually. So individuals are affected, like malaria and cholera. Okay. Now, next is non-communicable or non-infectious diseases. Here, the diseases are non-transmissible. That is, it does not transmit from one person to another. And where there's no involvement of germs. Okay, like diabetes, color blindness, heart attack, thalassemia, arthritis, etc. These are all non-transmissible or non-communicable or non-infectious diseases. Okay? Then we come to communicable or infectious diseases. These are caused by germs. They are transmissible, and the germs by which they are caused, they are known as pathogens. Okay. Their transmission from one person to one another is known as infection. Okay, we are calling it as infectious diseases. So what is infection? Infection is transmission of the disease from one person to another. And this appearance of the infection that sometimes varies from a few hours to a few days, where the germs does not show its appear does not show the infection show the infection. Okay, so that is known as incubation period. That time is known as incubation period, where the germ is inside the body but it is not showing the symptoms, not showing the infection. So that is known as incubation period. Like cholera, example of these infectious diseases are cholera, smallpox, malaria, etc. Now we come to uh, in incubation period is the entry, that is what is the in detail, what is the incubation period? The definition is the period between the entry of the germs inside the body and the appearance of the first symptom. That period is known as incubation period. Clear? Next is pathogens. Uh, there's a table which is showing the pathogens and the disease caused by that pathogen. Okay, like bacteria. Bacteria is the pathogen and the disease that is caused, that is cholera, typhoid, tuberculosis. Virus is the pathogen causing AIDS, chickenpox, hepatitis. Then protozoan, then which causes malaria, amoebic dysentery, dripping sickness, helminthisis, worms, diseases caused as ascaris, perniosis, and filariasis. Okay. Next we come to the incubation period of certain diseases. It's a table here which is showing that in pneumonia is a disease which has where the incubation period is 1 to 3 days, diphtheria is 2 to 5 days, cholera is 2 to 6 days, tetanus is 4 to 20 days, gonorrhea 5 to 10 days, poliomyelitis 7 to 14 days, typhoid 7 to 14, measles 10 to 11 days, then, sorry, measles is 10 to 12 days, smallpox 7 to 12 days, whooping cough 10 to 15, mumps 12 to 26 days, chickenpox 14 to 21 days, rabies about 1 month, leprosy up to several years it will not show the symptoms. So that is its incubation period. And HIV or AIDS that that may not show the symptoms up to 12 years or more years also. Okay, it will not show its symptoms. It will remain incubated. Okay. Now we come to certain diseases. First is the disease caused by bacteria. First one is cholera. Cholera, the organ which is affected is the intestinal tract. The pathogen that attacks the intestinal tract, that is bacterium, which is Vibrio cholerae. The scientific name of the pathogen is Vibrio cholerae. Please do note this pathogen, and while writing, please to underline, because this is a scientific name, generic, and the specific name, so we should underline it. You have studied earlier also. Okay, so bacterium is known as Vibrio cholerae, which causes the cholera. The incubation period of this is few hours to 6 days. The symptoms of this cholera is vomiting and loose motion, very little or no urination due to the shortage of water, that is due to dehydration inside the body. Urea gets accumulated in the body, which may be poisonous. Okay, and it can be fatal also if not treated properly and promptly. Okay, then we come to the treatment. What is the treatment of this cholera? Saline water injection to be given to supply water in the blood. Okay, that is, as there is dehydration, extreme dehydration, you can say, due to the cholera, loose motion and vomiting, the person affected should be given saline water injection to supply the water to the blood. Okay, now transmission, how it is transmitted, spreads through food and water. Okay, it spreads through food and water, and that is known as pico-oral route. Through this route, it spreads, and contamination is due to the dust and by dust transport by direct transport through flies, which sit on the patient's excreta and mechanically carry the germs which sticks to their spiny body and the legs. And when it sits on the exposed food, it contaminates that. And if you eat that food, then certainly it will cause cholera. So by the dust also and by direct transport to the flies. That is, flies sitting on the excreta of the infected person, and when they are sitting on the on the food that is exposed, and if you eat that food, actually the germs that will stick to the spiny body of the flies and the spiny body and the legs of the fly, and when they are sitting on the exposed food, that drop that germ inside that food, and if you eat that, it will certainly cause cholera. Then prevention is good sanitation, killing of the flies, keeping the food and cut fruits properly covered. Okay, so that the flies cannot reach them. Then water should be boiled, okay, and eating well-cooked food. We should eat well-cooked food so that the germs, if present, will be destroyed. Immunization is anticholeral injection. Okay, anticholeral injection is given to immunize the person who may get this cholera. Okay? Might get this cholera. Then we come to typhoid. Typhoid here, the organ which is affected is again the intestine. Okay? Now, pathogen is Salmonella typhi. It is also a bacterium which is a flagellated bacterium. That is the bacterium which is a flagella. This is known as Salmonella typhi, causing the typhoid. Incubation period is about 7 to 14 days and may be as long as 30 days also. Now, after recovering, in about 2 to 3 weeks, the patient is left very much weak. So after this typhoid, the person who is a patient, after recovering from this typhoid, in about 2 to 3 weeks, the patient becomes very weak. Okay? It can relapse also, and the person, after getting infected, they are the carriers also. Okay? Now, transmission, how they are transmitted. The typhoid is transmitted. The patient, when passes out the germs in his excreta, and if the flies sit on them and on the food, then it can be. And if any person eats that exposed food sitting on which the fly has sat, okay, where the fly is sitting, that food, if they eat, then that is, the person can get typhoid. Okay, direct contamination of food, particularly the milk. Okay, now what is the treatment? An antibiotic is given, that is chloromycetin, and prevention is anti-typhoid inoculation every year. Okay? Every year, anti-typhoid inoculation is given, proper sanitation, control of the flies. The symptoms of this typhoid are, the major symptom is continuous fever, usually rising in the afternoon, and reddish eruptions appearing on the chest and the abdomen. Okay, reddish eruptions that is appearing on the chest and the abdomen, and continuous fever. Generally, the major symptom is continuous fever, which is rising in the afternoon. Then tuberculosis. Third one is tuberculosis. The organ affected is lungs. And also some other organs are other than lungs that are affected. Those are brain, kidney, and bones. Okay, we call it TB. Okay. So tuberculosis is a disease where mainly the lungs is affected. The pathogen here is Mycobacterium tuberculosis. It's a small shepherd bacteria. Okay, the incubation period is 2 to 10 weeks. So what are the symptoms? Major symptoms is persistent cough, afternoon fever, bloody mucus, loss of weight and fatigue, chest pain and breathlessness also. Okay. So persistent cough, afternoon fever, okay, bloody mucus, loss of weight and fatigue, chest pain and breathlessness. The surrounding tissues form a kind of wall or tubercle around the germs. Okay, the germ, that is Mycobacterium tuberculosis, where the germ is affecting the surrounding tissues, they form a wall around the germs. And most people overcome this minor infection, but if there's low immunity, the disease becomes severe. Okay. Next is the treatment, how it is treated. The early stages, they are given streptomycin antibiotic, which inhibits the growth of the bacteria. Okay. And the prevention is BCG vaccine. And we celebrate March 24th as the anti-tuberculosis day. Okay, prevention is BCG vaccination. Okay. And mode of transmission is air, dust, sputum of the infected person. That is when they are coughing, no, the whole atmosphere near his area becomes full of germs, because the sputum of the infected person contains the germs. Okay, the mode of transmission is air, dust, and sputum. And then we come to see the picture of the germs. Okay, sore throat. This is caused by bacteria. So this is the germs, how they look like. Pneumonia has this rod-shaped bacteria. Then we have tuberculosis. Okay. Then typhoid is the flagellated bacteria. Cholera, this sheath-shaped type structure. Then gonorrhea is caused by like round-shaped bacteria. Okay. Now tetanus is like a bat. Okay, tennis bat, you can see like that, rod-shaped. Then syphilis is snake-like structure. Okay. So this is for today. This much is for today. Please to go through this video. If you have any doubt, please do write in the comment box. And if you're liking the videos, press the like button, share with your friends so that they can also be benefited from these videos. And if you are a new viewer to my channel or not subscribed yet, please do subscribe, because that will notify you as soon as a new video is uploaded. Okay. And do concentrate, do meditate before you start your day, before you start your job, what you are doing in the day. Okay, so do meditate for just at least 1 minute. Okay? And start your job. Okay? So thank you for joining and have a good day. Thank you.